Hi, so it's Petrokofsky. I work for something called Public Health England. I'm also a visiting professor at the University of the West of England. And I've been running a program for the past few years called Healthy Places, looking at the impact of the built and natural environment on health and well-being. Now, for what I'm going to talk about briefly is around Public Health England, just looking at some of the issues around health and climate change and what Public Health England is doing about it, and with some concluding thoughts as well. I'm assuming not many people in here have heard of Public Health England. We're an executive agency of the Department of Health and Social Care, and we are charged by government to help protect and improve the health of the population and fulfill the Secretary of State's statutory duty to reduce health inequalities. And I'm going to pick up some of this as we go along. And just to step back, because I think it's important, just to go over, what are the determinants of health and well-being? And this is a famous in public health circles diagram that's been adapted by colleagues. So the first thing that's impacting on your health is who you are. What's your age, your sex, your genetic load that you're carrying, and that's there in the first circle. That's going to have a big determinant on your health and well-being. The second element, though, is what you do. This is your behavior. Do you smoke? Do you drink? Do you take exercise? Do you have a good education? Do you have a job? Do you have money? These are huge impacts, the social determinants of health, and will have a huge impact on your health and well-being. Now we're moving out onto the blue field, I guess, which is the field that we're talking about today largely, is around the built and the natural environment, because where you live has a big impact on your health and well-being. I'm going to address some of that a little bit later. And lastly, increasingly with climate change, we find that where you don't live is going to have a big impact on your health and well-being. Rising sea levels from elsewhere are going to impact on us all. So just a bit of background. The UK was the first government to prepare an act looking at climate change, and it set strategic targets to reduce carbon dioxide emissions and committed the UK to an assessment of climate change every 5 years, a world leader. And the predecessor to the organization that I worked to, in 2012, we did an assessment of some of the risks to health and well-being from climate change. And that document painted a clear picture of some of the risks facing the UK, and since then, the risks have become even clearer. And the most recent assessment from the Climate Change Risk Assessment 2 years ago identified the increases in the frequency and intensity of flooding and heat waves as two of the most likely impacts associated with climate change in England. And a recent report in The Lancet has further amplified this. Now, I'm not going to go through the details of the individual health impacts here. These slides are going to be available and you can check them out. But we have things like rising temperatures, rising sea levels, changed rainfall patterns, and with changes in the climate are all going to change the risks that to people and the built environment. And climate change is going to create new challenges for those working in planning, community development, and the health and social care systems. And now also, it's not all necessarily negative. There are going to be some potential benefits from a warmer climate. Okay. Some of the, I'm zooming, some of the key facts. We know that 20% of homes are currently overheating in today's climate, and 90% of hospital wards are of a type prone to overheating. With an aging population that's more affected by hot temperature, these impacts could get considerably worse. And in fact, we think that there may be a rise of summer deaths, heat-related deaths, by over 250% by the 2050s. and those at risk of flooding increased by about 40%, from about 1.8 million now to about 2.5 million at minimum climate changes, temperature changes, and that's going to increase if we're on our current trajectory. Now, what does this have to do with housing and the built environment? The recent report from the Climate Change Committee noted that the UK's legally binding climate change targets will not be met without the near complete elimination of greenhouse gas emissions from UK buildings. However, emissions reductions from the UK's homes have actually stalled recently. So efforts to adapt the UK's housing stock to the impacts of changing climate for higher average temperatures, etc., we're currently lagging behind, and we've got to change things. The committee made some recommendations to government. I just wanted to look at the two of them is around looking at retrofitting existing homes and how we're designing and planning new ones. You know, for me, for the planning system, how do we start making it a level playing field for all developers and builders to start planning for climate change? Now, just jumping back, looking outside the house in our urban form, we know that the health and built environment, the way we design and build our towns and cities, can promote good health and well-being. It can promote physical activity in everyday life, can help people maintain healthy weights, facilitate access to healthy foods, prevent injuries, etc. Our team has produced a series of evidence-based reviews designed to be used in the planning process, and we've looked at these sort of areas and come up with a range of infographics to make it easy for planners and planning committees to look at the evidence and begin to apply it now. So lastly, what is Public Health England doing? We're working on developing the multidisciplinary evidence base and contributing to science that informs government policy and operational response. We continue to evaluate the public health impacts of extreme weather events, cold, heat, floods, and incorporate these into long-term planning. So it's not just emergency response, but how we're working with housing authorities and planners to try to design year-round. We're trying to ensure that public health and the wider healthcare system considers climate change as a health risk alongside with current other health priorities such as obesity, type 2 diabetes, etc. And of course, there's an element of us trying to promote individual behavior change, active travel, less car usage, thinking about what we eat. But importantly, working with built and natural environment professionals and policymakers to improve housing, urban design, transport, to create those healthy places that support healthy lifestyles. Lastly, here's a place that was designed up in Norwich. It seems to me, I have no idea if it's got good through ventilation, but it seems to me it is designed with one, and not, for example, where we see all too many of our urban developments now, where we're going to have older people trapped in exceedingly hot apartments with no through breezes and a complete reliance on air conditioners and other things that's going to be contributing to climate change. Thank you very much.